we're going to talk about how to relieve your knee pain. So first of all, let's just talk about the knee itself. The knee is a very complex, very mobile joint and designed to take lots of weight, pressure, force, and exertion. So because of those reasons, lots of different issues can happen within that joint. Knee pain may be the result of an injury, maybe a ruptured ligament or torn cartilage, or it could be from a medical condition like arthritis or infections or even gout. That can also cause knee pain. Physical therapy and knee braces can really help relieve knee pain. In some cases, however, your knee may require surgical repair. However, that is not super common, and that will be really a last resort type of situation. Now we're going to talk about the symptoms related to your knee pain. These are really going to be a great idea to keep an eye out for these symptoms. That way it's going to let you know if you have a very serious underlying issue with the knee, or if this is just normal wear and tear or a joint being tired. The location and severity of knee pain may vary depending on the cause of the problem. Some of the signs and symptoms can accompany knee pain. It can include things like swelling and stiffness, any redness or just it feels warm to the touch, weakness or even instability, popping or crunching noises, or even the inability to fully straighten the knee. If you have any of these symptoms that you're really experiencing, it would be a great idea to really seek help from your doctor, from your medical health professional, to really seek some guidance on how to target your specific knee pain and what your underlying issue truly is. Now we're going to talk about risk factors. These are going to be several different risk factors that you can try to avoid that really help cut down on any kind of knee injury or knee pain. Excess weight is a huge risk factor. Being overweight or obese increases stress on your knee joints, even during ordinary activities like walking or going up and down stairs. It puts you at increased risk of osteoarthritis by accelerating the breakdown of joint cartilage. Any excess weight we have really contributes to how that cartilage is broken down. So it would be a great idea to really be mindful of what you're putting in your body. That definitely affects our joints. Lack of muscle flexibility or strength. That is a huge risk factor. A lack of strength and flexibility are among the leading causes of knee injuries. Tight or weak muscles offer less support for your knee because they don't absorb enough of the stress exerted on the joint. Certain sports are also a very key risk factor that you could really be mindful of when really looking at your knee pain. Some sports put greater stress on your knees than do others. Alpine skiing, maybe with its rigid ski boots and potential for falls. Basketball's jumps and pivots and the repeated pounding your knees take when you run or jog. These are all examples of how this can increase your risk of a knee injury and knee pain. A really common way to treat knee pain is called the RICE treatment. It is an acronym. It stands for rest, ice, compression, and elevate. Taking a break from your normal activities to reduce repetitive strain on your knee can give the injury time to heal and prevent further damage. A day or two of rest may be all you need for a minor injury. More severe damages are likely to need longer recovery time. Ice is the next one. Ice reduces both pain and inflammation. A bag of maybe frozen peas works because it covers your whole knee. You can also use ice packs, and don't use it for longer than 20 minutes at a time because of the risk of damage to your nerves and skin. Compression helps prevent fluid buildup in damaged tissues and contains knee alignment and stability. Look for a compression bandage that's lightweight, breathable, and self-adhesive. And finally, elevation. To help reduce swelling, try popping your injured leg on pillows or sitting in a recliner. A really great way to target your knee pain is going to be with a TENS unit. Electrotherapy is a really non-invasive, great way to target your knee pain right at home. TENS machine works by creating a tingling or buzzing sensation on your skin. This can help to block or suppress pain messages to your brain. TENS unit also helps to stimulate our body to produce higher levels of our own natural painkiller called endorphins. Thank you guys so much for joining us today on how to relieve knee pain. We've given you some great tips, including the RICE treatment, to really help target that knee pain. But don't forget to drop your comments below on how you like to relieve your knee pain at home. And we also don't want you to like and subscribe so we can keep you up to date on everything we have for you here. Thanks for joining. See you next time.